Welcome, everyone. It's a great pleasure for me to introduce Dr. Ray Dorsey to celebrate the launch of this exciting book along with his three co-authors, Ending Parkinson's Disease, A Prescription for Action. In a few minutes, Ray will highlight the reasons for the rise of Parkinson's and what we can do to prevent and end this disease, allowing time for questions and answers. But first, I just want to say a few words about Dr. Dorsey, the author. Dr. Dorsey Ray is the David M. Levy Professor of Neurology and the Director of the Center for Health and Technology here at the University of Rochester. He received his undergraduate degree from Stanford and his MD and MBA at University of Pennsylvania. Ray is a tall man with big ideas who is known for his short phrases. The vision for the Center for Health and Technology is only 3 words: do the unprecedented. And he has been doing that ever since I have known him for over 15 years, transforming the way we deliver care and the way we conduct research. Another one of Ray's short, pithy phrases is actually only 2 words: anyone, anywhere. A simple pledge to level the playing field and enable anyone with Parkinson's disease and other diseases to actually receive care or research no matter where they live across the globe. And that's precisely why I was not surprised by his next big idea, short phrase, ending Parkinson's disease. And the more you get to know Dr. Dorsey, the more you appreciate that he is a man of contradictions. He is big and short, driven yet loyal, global yet local. He's impatient but kind, opportune but fair, calculating yet inspiring, expansive yet laser-like. These contradictions represent the unmatched qualities of what it will take to do precisely what he pledges to do the unprecedented, to see anyone anywhere, and to now end Parkinson's disease, and I know he can do it. So it is my pleasure to introduce Dr. Dorsey to discuss his book and his quest to end Parkinson's. Ray?
Thank you very much, Bob, for that very kind introduction. Today, we are in the midst of confronting 2 great health challenges, one that is receiving attention and one that is not. Together, we can overcome both. This afternoon or evening or morning, depending on where you are in the world, we're going to discuss COVID-19, the coronavirus that we're currently confronting us in society, and Parkinson's disease, discuss the age of degenerative and man-made diseases in which we live today, the rise of Parkinson's disease from once a very, very rare disorder to now the world's fastest growing brain disorder, and then how we can end Parkinson's disease together. So as many people know, the COVID-19 virus is affecting communities around the world. Individuals who are at higher risk for the disease include older adults, individuals who have serious chronic conditions like heart disease, diabetes, lung disease, and consequently, individuals with Parkinson's disease may also become at higher risk of becoming sick. But we need not panic. We have confronted much worse. In the 1950s, polio closed down schools, churches, community centers, religious establishments, because people were afraid that their kids would contract polio and become paralyzed for the rest of their life. 30 years later, in 1981, an outbreak of a rare cancer was identified among homosexual men in New York City. HIV was unknown, AIDS was uniformly and rapidly fatal, and the federal response was silence and ignorance. In the setting of that challenge, a group of activists rose to the occasion, transformed HIV into a chronic lifelong condition, and has prevented millions, thousands, if not millions of us from ever developing the disease. We too will get through this challenge of coronavirus, and once we do, we'll turn our attentions to Parkinson's disease. But for those of you who do have Parkinson's disease, you should not take the coronavirus lightly. You should ensure that you have an adequate supply of medications, especially levodopa. You should have like 30 to 60 days, maybe 90 days at the most, but you need not hoard, or in the words of my co-author, Bas Bloom, be a hamster and gather up all the medication, because we want to make sure that medications are available for all those in need. 2, you should remain physically separated but socially connected. You should stay about 6 feet at least away from other individuals, if not more. We're here at the University of Rochester auditorium, and there are 3 of us here in the front and 2 in the back. But you should stay socially connected. You should stay in touch with your friends, your loved ones, and one of the reasons we're hosting this webinar is to enable the Parkinson's community to stay together. You should avoid crowds. You should let someone else do the shopping for you for your groceries or your prescription medications. You should get outside and get fresh air and take a walk every day. As many of you know, exercise helps individuals with Parkinson's disease and even helps prevent Parkinson's disease. So you should you should continue to stay physically active despite the coronavirus that's confronting us. Importantly, you should not smoke. Few people with Parkinson's disease, I assume, vape, so you shouldn't vape or be around people who smoke or vape, because coronavirus affects the linings of our respiratory tract, of our lungs, and as does smoking. And we want to have nice, fresh, and resilient airways when we're confronting the coronavirus. You should obviously seek medical attention if you develop a fever, new cough, or shortness of breath. And importantly, you should have access to a web camera so you can see a doctor or other clinicians remotely. We've been providing care to individuals with Parkinson's disease via telemedicine, remotely, video visits for the last 13 years. We currently operate a program called Parkinson's Disease Care New York. Simply put, if you live in the state of New York and you have Parkinson's disease, we'll care for you in your home with experts for free through June of this year. If you live in the state of New York, you have Parkinson's disease, and you need to see a specialist, my colleagues and I at the University of Rochester will connect to you in your home, regardless of your ability to pay, for free from now through June of 2020. After that time, we're putting in a self-pay model. It will be $90 a visit. And if that's a financial burden to you, we're offering scholarships to individuals. Currently, Medicare covers home visits for telemedicine for coronavirus, but not for Parkinson's disease. Our program has been generously supported by the Greater Rochester Health Foundation, the Edmund Safra Philanthropic Foundation, and the Parkinson's Foundation. If you or friends or colleagues think you could benefit from this program, you can visit our website, pdcny.org. We obviously have limited capacity, but we hope to use that capacity to serve as many people as we can, and currently we are here and ready and willing and able to help you. This is the website. You can simply click on book an appointment to book an appointment, and you can click on then for a new patient. You fill out a simple form that takes you 15 to 20 seconds to fill out, and we'll contact you. In addition, we have an 800 number on our website if you're more comfortable with that. So now we live in an age of degenerative and man-made diseases, and I told you that Parkinson's disease is the world's fastest growing brain disorder. It's faster growing than even Alzheimer's disease. Between 1990 and 2015, the number of individuals with Parkinson's disease more than doubled worldwide, and absent change, it will double again in the coming 25 years. It's growing in virtually every area of the world. The rates of Parkinson's disease are highest in the industrialized world, lowest in the least industrialized parts of the world, and growing most rapidly in countries undergoing the most rapid industrialization. Every society creates its own diseases. This was the theme of the French-American scientist René Dubois, who wrote that every civilization has its own kind of pestilence and can control it only by reforming itself. The coronavirus, indeed, is a result of man-made actions. Likely due to man-made actions, including the slaughtering of exotic and wildlife animals in markets in China, which have led an animal virus to be transmitted to humans. To the extent that we are contributing to our own diseases, we can end many of these diseases, including likely Parkinson's disease. Dr. Abdul Almiran in 1971 wrote an important article in which he highlighted the various phases of epidemiology. He said that early humans initially died from pestilence and famine. quite frankly, we had not enough food. And then the agricultural revolution 10,000 years ago addressed a famine for large portions of the world. And then we were subject to infectious pandemics, such as the bubonic plague in the 1300s and the influenza pandemic in 1917, which killed 50 million people worldwide and about 500,000 Americans. And he says, now that we live in the age of degenerative and man-made diseases, and we're going to discuss smoking, and we're going to discuss how Parkinson's disease, to some extent, may be man-made. And then he forecasted delayed degenerative diseases and emerging infections, ones born out of hubris, such as perhaps the coronavirus, in which animals were slaughtered, wildlife animals were slaughtered for the benefits of the rich and powerful, something that we need to cure among ourselves. So as most people know, lung cancer is clearly a man-made disease. In fact, before the advent of cigarettes in the late 1800s, doctors took special notice when confronted with a case, thinking that a once-in-a-lifetime oddity. Lung cancer deaths, as you can see, in the early 1900s were almost zero, almost didn't exist. But after cigarettes were introduced 25 years later, you can see a very similar rise in lung cancer deaths. Fortunately, smoking across the world has been decreasing, and you can see a corresponding decrease in lung cancer deaths 25 years later. So what does this portend for Parkinson's disease? When Dr. James Parkinson, a British physician, described the condition in London in 1817, he was describing what's, in his words, something that had not been classified in the medical literature before. He described 6 individuals, 3 of whom he simply saw walking on the streets of London with a new disease, a disease that was characterized by a flexed posture, a pill-rolling tremor, and an unsteady gait with a propensity to fall. 60 years later, Dr. Jean-Martin Charcot, the father of modern neurology, called it Parkinson's disease, or la maladie de Parkinson. And in 1950s, we identified that individuals with Parkinson's disease had decreased levels of dopamine in their brain, leading to the first miracle in Parkinson's disease, the development of levodopa as a highly effective treatment to treat the symptoms of Parkinson's disease. In 1983, Dr. Bill Langston and his colleagues in Sunnyvale, California, identified the first environmental cause for Parkinson's disease. And in 1997, the first genetic cause for Parkinson's disease was identified. Importantly, these environmental and genetic factors likely interact with one another and contribute to who will eventually develop Parkinson's disease. In 1987, we had the second miraculous treatment developed for Parkinson's disease, that of deep brain stimulation. In 2003, a German pathologist, Dr. Heiko Brock, proposed that Parkinson's disease does not actually begin in the brain, but actually begins in the nose and the gut. And today we're confronted with a disease that's growing again faster than any other in the world. So what's going on in 1817 when Dr. James Parkinson, a 61-year-old physician, writes his essay on the shaking palsy, which became known as Parkinson's disease? Well, 1817 is the height of the Industrial Revolution, and England's the capital. The streets of London were so dirty that one could not see across the street. The London fog had little to do with weather and everything to do with air pollution. You can see in this picture that individuals walking on the streets would cover their mouths and faces to prevent the toxic effects of air pollution. If you fast forward to the present time, this would not be too dissimilar from the streets of Beijing, where the rates of Parkinson's disease are growing faster than any other place in the world. We know that Parkinson's disease, as Dr. Brock indicated, may not begin in the brain, but actually may begin in the nose or in the gut. And indeed, the first symptoms of Parkinson's disease are not the tremor or the slowness of movement, but actually loss of smell and constipation. And as individuals live longer and longer, it allows the disease, which takes decades to unfold, to become present. So as people live into their 60s, 70s, and 80s, it allows more time for the other symptoms of Parkinson's disease, such as sleep disorders, anxiety, depression, and eventually tremor, and eventually cognitive impairment to develop. And so Parkinson's disease has risen with numerous environmental factors. 4 have been linked to the disease: air pollution, heavy metals, certain pesticides, and industrial chemicals. And again, you can see that the rise in air pollution in Europe, followed by North America, and then followed by Asia, essentially mirrors the rise in Parkinson's disease throughout the world. Indeed, areas of the world that are least industrialized, like Africa, tend to have the lowest rates of the disease, but their practices and their industrial practices are increasing, and so too are their rates of Parkinson's. Another factor linked to Parkinson's disease are pesticides. Some are naturally occurring, like rotenone. Some are synthetic, like paraquat. These synthetic pesticides, those created by humans, were largely introduced in the 1950s, and their use has increased ever since. Over dozens of studies have linked pesticides to Parkinson's disease, done by investigators in multiple different countries with multiple different pesticides, but not all pesticides. Only certain pesticides have been linked to Parkinson's disease. One that has been clearly linked to Parkinson's disease is a pesticide called paraquat. It's considered the most toxic herbicide ever created. It kills the weeds that Roundup cannot, and 32 countries, including China, have banned this pesticide. However, in the United States, use of this pesticide has more than doubled in the last 10 years. This is a map from the U.S. Geological Service, which provides a high estimate for the use of paraquat, and you can see it on farm fields throughout the United States. In addition, certain pesticides or industrial chemicals that have been associated with Parkinson's disease. Among them is a chemical called trichloroethylene. According to the New York Times, trichloroethylene, or TCE, was ubiquitous in the 1970s, used in many different occupations, among them dry cleaners, mechanics, oil processors, printers, embalmers, and many others. It was found in consumer products and still found in many consumer products. Among the consumer products in which it has been used in the past are adhesive, carpet cleaners, paint removers, stain removers, metal degreaser, and even used to decaffeinate coffee as late as the 1970s. And as we'll discuss, there are many toxic contaminated sites with trichloroethylene, leading to something called vapor intrusion, in which the chemical evaporates from the ground. And trichloroethylene contaminant is the most common organic groundwater contaminant in the United States, contaminating up to 30% of the groundwater supply. Our book, Ending Parkinson's Disease, highlights all of this and tells the stories of many individuals. One person I would like to highlight is Danny Fromm, who's participating on this webinar today from Idaho, and he began using trichloroethylene in the aerospace industry in 1988. I'll just read from the opening of Chapter 5, Cleaning Up, How Solvents and Contaminated Groundwater Spread the Disease. In 1988, Danny Fromm was a typical Southern California teenager who enjoyed working on cars, especially his red 1972 Chevy Nova with a black top. He paid $1,300 for it, money he had saved from working as a gas station attendant at the local Unocal 76. Fromm and his buddies replaced the car's engine, which made it really awesome and really fast, he recalled. The car gave the 17-year-old the freedom that he craved, freedom to do what he wanted when he wanted. Freedom that he no longer has. Straight out of high school, Fromm began working in the aerospace industry, cleaning circuit boards with the solvent trichloroethylene, TCE. Never warned of any risk or provided with protective gear, he inhaled the sweet-smelling chemical and exposed his skin to it for 8 hours a day over the course of a decade. When Fromm was 35, he noticed that his right pinky kept twitching. Stress, his first doctor said, and recommended a little wine. His second doctor gave him a much different diagnosis: Parkinson's disease. Danny Fromm then started levodopa, developed some complications from the medications in which he was had involuntary movements of his head, neck, and trunk, and eventually had deep brain stimulation done. Danny Fromm is now 48 and lives in Idaho with his wife and 6-year-old son, Logan. He has 2 older sons who live nearby with their mother. In the morning, Fromm has trouble walking. He has what he calls a hardcore shuffle. So he takes his medication immediately after he wakes up, and he does leg exercises to relieve his leg stiffness. He's then able to get out of bed, shower, and dress without assistance. Danny Fromm regrets every day that he stayed at his aerospace job, working with trichloroethylene, sometimes called tri or trike. While the solvent has not been proven definitively to cause Parkinson's, those who are exposed to it at work are 6 times more likely to develop the disease than those who are not. If you're working with it, Fromm says, quit your damn job and get away from it. This is Danny Fromm today in Idaho. These are pictures courtesy of him and his wife, Kelly, showing him and his son, Logan, enjoying the life that he now lives with Parkinson's disease as an active participant and contributor to the Parkinson's community. I want to thank him, his family, and many others for sharing their stories that we recount in the book. So it's not only individuals like Danny Fromm who work directly with trichloroethylene who are at risk from developing Parkinson's disease. Trichloroethylene is found in half of Superfund sites throughout the United States, sites that are so contaminated that the federal government has designated them for cleanup, many of them from industrial and Department of Defense contamination. They're found in virtually every state throughout the country, and thousands others that aren't Superfund sites are found throughout the country as well. Trichloroethylene, it comes out of industrial factories or often dry cleaners, and it's poured directly into the groundwater where it contaminates the groundwater and soil. And they can then move in plumes and evaporate from groundwater and soil, enter into people's homes and office buildings and workplaces undetected. This is much like radon, which can evaporate from the soil, enter people's homes, and cause lung cancer. Trichloroethylene can evaporate from the groundwater and soil, evaporate into people's homes. It's a carcinogen by all routes of exposure. It causes cancer and likely contributes to Parkinson's disease. I found in the course of writing the book that there was a site, contaminated site 15 minutes from my house. And I live in Pittsford, New York. And in Victor, New York, there is a contaminated plume. You can see the extent of that plume coming from a freshwater spring called Modoc Road Spring in Victor, New York. One individual highlighted in the story lived in this area every 3 times a week, ran up the hill past the contaminated site, and then one day noticed that the individual could no longer run up the hill and was subsequently diagnosed with Parkinson's disease. These contaminated sites impact communities across the country. As I alluded to, there are thousands of them. There are 21 contaminated sites in Silicon Valley alone with trichloroethylene, including one under the headquarters of Google. There are numerous other sites in Mansalona, Michigan, and Las Vegas, Nevada, to just highlight 3. Jane Horton, another person who volunteered to share her story for the book, lives across the street from the Superfund site underneath the headquarters of Google that was contaminated by 2 previous companies, Fairchild Semiconductor and Intel, which used the chemical to clean silicon wafers. She found out about the contamination, had her indoor air tested in her house, and found to have levels of trichloroethylene or TCE substantially above that recommended by the EPA. She had a remediation system. The nice thing about TCE, it can be remediated. She had a remediation system that essentially takes air from underneath her house's foundation and releases it above her roof. She now says that she has the cleanest indoor air in all of Mountain View, California, and has her air tested regularly. So how can we end Parkinson's disease? In our book, we put forth a PACT, P-A-C-T, to end Parkinson's disease. The 4 components are 1, prevent, 2, advocate, 3, care, and 4, treat. The first response to any crisis is to contain it. Whether it's a fire, the coronavirus, or Parkinson's disease, we want to first contain and prevent the disease from being spread to others. We're trying to do that for coronavirus. We need to stop fueling the rise of Parkinson's disease and prevent people from ever developing in the first place. We can do that by banning a pesticide that 32 other countries have been able to do, called paraquat, and we can get rid of trichloroethylene. The EPA has proposed banning trichloroethylene, but that ban has been postponed indefinitely. You can also test your indoor air in private wells. 40 million Americans get their water from a private well. These private wells are not regulated by the Safe Drinking Water Act, which protects water for municipal water or city water. So you can test your private wells, and if you live near one of these contaminated sites, you can test your indoor air. At the end of our book, we have black-colored pages that provide the prescription for action and tell you and give you the resources and websites you can go to have your wells tested and your indoor air tested. There are also individual behaviors that we can do. Vigorous exercise in your 50s can decrease your risk of developing Parkinson's disease by about 20% a decade later. A Mediterranean diet may also decrease your risk of developing Parkinson's disease, as can modest amounts of caffeine. We need to advocate for better resources and policies. We need to increase the funding for research for Parkinson's disease. At the same time, the number of Americans with Parkinson's disease has increased 35% over the last decade. Funding from the NIH for Parkinson's disease, adjusted for inflation, has actually decreased. We can support research efforts and enable anyone, anywhere to participate in research, and you can share your story about Parkinson's disease, and we hope to have our website configured in the future for you to be able to share your story directly on the website. We should be able to care for anyone affected by the disease. You should be able to receive the care you need on your terms. We should bring care to you instead of bringing you to care. As I mentioned, Medicare doesn't currently cover telemedicine when provided into the home. $500 million was allocated to cover telemedicine for Medicare beneficiaries for coronavirus. We should extend that benefit to people with other conditions like Parkinson's disease, Alzheimer's disease, and other medical conditions. You can also learn more about Parkinson's disease. We provide you many pages of resources about how to learn about Parkinson's disease in the book. Finally, we need to treat the condition with novel therapies. The most effective therapy for Parkinson's disease is now 50 years old. There's few conditions for which that's the case. And while levodopa is highly effective, it doesn't treat the underlying pathology of the disease and has its own complications. You can join a clinical study. The Michael J. Fox Foundation has something called Fox Insight, which enables people to participate in studies remotely, and we give you additional resources and opportunities to participate in research through the book. You can know your ancestry and your genetic risk. The Parkinson's Foundation has a PD generation study, which enables people to pursue genetic testing and counseling in their own communities. As I alluded to, we should enable anyone, anywhere to participate in research should they want to do so, and we highlight opportunities to do that in the book. Before taking your questions, I want to thank my fellow authors. Dr. Todd Scher, misspelled here, S-H-E-R-E-R, is the Chief Executive Officer of the Michael J. Fox Foundation. He and his colleagues conducted pioneering research 20 years ago, demonstrating that chronic exposure to pesticides leads to the features of Parkinson's disease in rodent models. Dr. Michael Oken is a Parkinson's disease specialist and the chair of neurology at the University of Florida. He has pioneered deep brain stimulation treatments for thousands of individuals, and is also the chief medical officer of the Parkinson's Foundation. And Dr. Bas Bloom, the senior author in the book, is participating in this webinar remotely. He'll probably text me momentarily to tell me what I missed. He's based in Radboud University in Nijmegen, the Netherlands, and has developed the world's largest expert care model called Parkinson's Net for anyone with Parkinson's disease. I also want to thank our talented team at the University of Rochester, including Abigail Arkey, Olivia Brumfield, Gerardo Torres de Davila, Alistair Glidden, Rini Marcello, Karen Rabinowitz, Kelsey Spear, Anna Stevenson, Emma Waddell, Ellen Wagner, Taylor Myers, the entire Chet team. They have put this whole webinar together under very trying circumstances. We were trying to do this in person and have numerous events, but the coronavirus had other ideas, and so they put this together for everyone to enjoy, hopefully remotely. And special thanks to the many individuals who shared their stories. Many of them are listed here, and there are many others who also shared their stories. And this book would not have been possible without the help and support of those affected by Parkinson's, the community of Parkinson's disease researchers on which much of this book is based, and the clinicians and multidisciplinary care teams, as well as our friends and families. In the 1980s, the HIV activists adopted a motto called "Silence equals death." And for them, silence did equal death. For us in the Parkinson's community, silence equals suffering, needless suffering, suffering that we can end by making our voices heard. We've written this book for the Parkinson's community. Our greatest hope is that this book will galvanize action so that we can prevent and end this disease. The book is available through our website or available on Amazon, Barnes & Noble, or discounted bulk orders can be placed at BookPal. As of last week, we've only sold about 400 copies of the book on Amazon. We need to do way more. We need to think about 4,000 or 40,000 or 400,000. There are 1 million Americans who have Parkinson's disease. We need to make our voices heard and to help end this disease. Thank you very much. We're now going to take some questions, and Abigail Arkey has been, and Kelsey Spear have been participating with you online.
All right, so first question for you, Ray. Gina from South Carolina asks, how can our lifestyle influence the development of PD?
So how can your lifestyle influence Parkinson's disease? So there's some lifestyle factors that can decrease your risk of Parkinson's disease. Vigorous exercise, 3.5 to 4 hours a week of running or swimming or the equivalent, can decrease your risk of developing Parkinson's disease by about 20%, according to a couple studies. You can eat a Mediterranean diet, one that's low in animal meat products, and that can also potentially lower your risk by about 20%, although less robust evidence for that. And then modest amounts of caffeine, the equivalent of 1 to 4 cups of caffeinated coffee, may also decrease your risk of Parkinson's disease. It's not the coffee so much as we think it is the caffeine, so you could be your caffeinated beverage of choice. Importantly, caffeine has its own side effects, so you should know about those, including anxiety and headache.
Next up, Nora from Wyoming was asking, what is the risk for PD if one was a welder for 15 years? What exactly about welding causes PD?
So what about welding causes Parkinson's disease? It's likely the manganese that's in the welding that's inhaled in the fumes and causes Parkinson's disease or a Parkinsonian syndrome that's characterized by slow movements, for example. I can't give you what the exact risk is for welding for 15 years, but if I saw a welder who worked as a welder for 15 years and had Parkinson's disease, that would be my first thought, is that welding likely contributed to his or her disease.
All right, next we have a question from Ted from the Netherlands. He writes in, I'm looking forward to reading your new book with its promising title. I would like to know to what extent you believe a solution for Parkinson's disease will originate from a pharmaceutical domain as opposed to a more psychological or even spiritual realm.
I think the key to ending Parkinson's disease, to ending any disease, is to prevent it from ever happening. So the way to cure lung cancer isn't necessarily to come up with new treatments for it, although that's important for people who have the disease. We need to take care of them, but it's to stop smoking. If we stop using certain pesticides that we know are linked to Parkinson's disease, if we stop using trichloroethylene that we know is linked to Parkinson's disease, if we clean up contaminated sites and well water and that we know are linked to Parkinson's disease, we can prevent people from ever developing the disease in the first place. For polio, few of us worry about polio because we have vaccines that prevent it from ever developing it. We should think about what are ways that we can prevent people from ever developing Parkinson's disease. We don't want to be cured of Parkinson's disease. We do want to be cured of Parkinson's disease, but more importantly, we never want to develop Parkinson's disease in the first place.
Suzanne writes in asking, how does one test the water or air for trichloroethylene? We're going to have our prescription for action. It tells you exactly how to do that, so I'll consult it. So if you want to test your water, so for example, you have a private well, you can call the EPA Safe Drinking Water Hotline at
800-426-4791, or you can visit the EPA's website on private wells, epa.gov/private wells. If you want to test your air, you can visit the EPA's site on indoor air quality. It's epa.gov/vapor intrusion, and you can identify Superfund sites near you on the EPA's website. These are resources, obviously, for those in the United States. We're going to have my colleague, Dr. Boss-Bloom, and others try to develop some of these solutions for people who live outside the United States, and we'll be happy to post these with the video.
Next question for you. How can ordinary people help out with the stigma that PD patients sometimes experience? This is from Liz.
Well, I think the greatest example are HIV activists. So in the 1980s, the initial response was ignorance or blaming the victims, blaming people who were infected with HIV for their own diseases. What's changed were those communities that were most directly affected by the condition rose up, reached out to their friends and families, and among the many things that they did was they created a quilt that covered the National Mall and brought attention to HIV. Importantly, individuals with the condition also shared their stories, whether that was Rock Hudson or Ryan White, who received HIV from blood transfusions as a teenage boy and suffered uncountable discrimination and even had to move from his own school to another school to continue his education. When people like Michael J. Fox and Alan Alda come forth and share their story with Parkinson's disease and continue to live long and productive lives with the disease, I think that reduces the stigma and reduces the burden for many people. And these people should be applauded and thanked for standing forth and saying that, I have Parkinson's disease, but I can live with it and shoulder the burden and reduce the stigma for all of us.
Does knowing what caused an individual's Parkinson's disease change the kind of care they should get?
I don't think we know the answer to this. Actually, before writing the book, I almost never asked someone why they developed Parkinson's disease, and now I do almost every time, and usually can at least find a risk factor after a short conversation. We don't know if the treatments for different causes of Parkinson's disease should be different. We're making headway in terms of subtyping Parkinson's disease by genetic factors. So we know that, for example, people who have Parkinson's disease due to a genetic mutation called GBA have a different disease course due to that. And pharmaceutical companies are developing therapies that are targeting the underlying genetic causes of Parkinson's disease. And Mr. Jonathan Silverstein is helping lead those efforts. For the environmental causes, I don't personally know. Maybe Dr. Boss-Bloom will tell me in a second whether people with Parkinson's disease due to pesticides, certain pesticides or industrial solvents are likely to cause it or should affect the treatment.
Along the same lines, do you think there should be more research into young onset PD?
Absolutely. So we don't have great data. A study done about 20 years ago suggested that only 4% of individuals with Parkinson's disease had age of onset below the age of 50. My sense is that the numbers are higher. It initially has been thought of that people who have the onset at before age 50 are likely to have genetic factors play more of a role in that. I've also become increasingly concerned after listening to many people's stories, including Danny Fromm, that environmental factors may be playing a role with such individuals. And there's clearly an interaction between genetic and environmental factors. So we know many of the genes linked to Parkinson's disease, such as LRRK2, have interactions with pesticides and lead to greater loss of nerve cells in animal models when they get exposed to both when genes interact with environment, you can have greater loss of nerve cells.
We've had a few questions come in about trichloroethylene. So first is there web access to any type of map showing trichloroethylene plume contamination in the U.S.? And then second, how do we advocate for continued or aggressive cleanup of these sites?
So we provide a map of contaminated sites within the United States in the book. And I think I showed it to you in the presentation. That's a map of the Superfund sites that are located in the location of the Superfund sites, but there are thousands of others. I'm unaware of any resource that lists them all. We've identified many just in our own community here in upstate New York, and we know there are many others. We'd love to have a resource like that developed. What will change this is activism. So I alluded to that we've had marches on Washington for HIV. We have huge races to raise awareness and funds for breast cancer. We had a March of Dimes in which millions of Americans sent in dimes to the White House to raise funds for Franklin Delano Roosevelt and the government to fund the development of vaccines developed by Dr. Jonas Salk and Albert Sabin that prevented millions of people from ever developing the disease. We've never had, to my knowledge, a Parkinson's March on Washington. We've never had 1 million people go to the EPA and say we need to ban paraquat, we need to ban trichloroethylene, we need to hold the Department of Defense and industries accountable for cleaning up these contaminated sites near our neighborhoods and schools.
Someone just wrote in, I was diagnosed with PD 2 weeks ago. What should be my first steps in dealing with this disorder?
So there's some initial first steps. Self-serving, but I think you should see a Parkinson's specialist. We know that individuals who do not see a neurologist, and 40% of Americans with Parkinson's disease do not see a neurologist soon after diagnosis, they're more likely to fall and fracture their hip, more likely to be placed in a skilled nursing facility, and more likely to die early. So I would find a Parkinson's specialist if that's an option to you. I would exercise, and I would exercise a ton. I routinely recommend that individuals with Parkinson's disease exercise at least an hour a day. And then I would talk to your physician about considering, if you're disabled by your symptoms, considering medications, the most effective of which is levodopa for Parkinson's disease.
Have you any view on the potential link between PD and celiac disease?
So the link between Parkinson's and celiac disease, I do not know of a link. There are neurological manifestations due to celiac disease. I don't think Parkinson's disease is a common one. If I'm mistaken, we'll post a correction with the video, which we're planning to post ideally later this week on endingpd.org.
Our next question for you. Do you think there should be more funding of diet and exercise-focused trials and research?
So should there be additional funding of diet and exercise studies in Parkinson's disease? Yes, because we increasingly find that exercise is quite valuable, and numerous studies have demonstrated the value of exercise for Parkinson's disease. One of the most prominent ones was that of Tai Chi, published in the New England Journal of Medicine, which demonstrated that Tai Chi can improve balance and reduce falls in individuals with Parkinson's disease. Exercising, bicycling, even the tango have been shown to be beneficial in Parkinson's disease.
Do you look at differences between men and women's risks and presentation and potential for drug development by looking at those differences?
So men are at 50% increased risk of developing Parkinson's disease compared to women. About 60% of people with Parkinson's disease are men. I think that the biggest factor are not necessarily biological differences between men and women, although those may contribute to the disease. I think it's environmental exposures. So for example, in the United States, 75% of farmers are men, and if you go back 20, 25 years, it was likely higher. 97% of pesticide workers in the United States are men. Welders, for example, tend to be more likely men. Many of the occupations linked to Parkinson's disease have historically been more commonly filled by men. And so I think those environmental factors are contributing to the differences between men and women, although there is a literature about some of the biological differences that are accountable. Again, I think this highlights the need to prevent the disease so people never have to deal with it in the first place.
We have another question focused on therapeutic development. Do you feel that there is potential in looking at anti-inflammatory treatments for PD and potentially therapeutics around the leaky gut and blood-brain barrier for the gene?
So many people have highlighted that there's an inflammatory component to Parkinson's disease, and the thought is that anti-inflammatory medications may be of help, and they may be. We have yet to identify one. There have been some small studies with existing anti-inflammatory drugs, which have not demonstrated significant benefit. Leaky gut. There's Parkinson's pathology found in some individuals in the gut early. It's an active area of investigation. In addition, the gut microbiome, the bacteria that are found in the gut of individuals with Parkinson's disease are differ from those without. In the book, we highlight some research that demonstrated that when transferring the bacteria from individuals with gut to mice, they developed Parkinson's disease. So it's clearly an area of additional investigation. It's also worth considering that many environmental risk factors, such as certain pesticides, enter in through the gut.
We have a question about COVID-19 and PD. Do you think that we are at greatest risk if we get it due to swallow function problems?
So about coronavirus and Parkinson's disease. So individuals with Parkinson's disease have impaired swallowing function, which puts them at higher risk for developing pneumonia from just aspirating, independent of the coronavirus. So yes, individuals who have impaired swallowing function, I'd be more concerned about coronavirus. If you do become infected, I'd be really vigilant about my swallowing function. So some simple solutions are using straws to drink water, for example, which can decrease the risk of aspiration. Sitting upright when you drink and eat, not drinking or eating in bed, especially if you're sick. Those are some things that you can do to decrease your risk of aspiration, which should be avoided, especially if people are infected with the coronavirus or any virus for that matter.
Hello, my mom is in Lithuania and has had PD for over 10 years. She uses levodopa. I'd love for her to consult with someone in the U.S. as well. Do you know of any options? Well, so one of the major challenges in the U.S. and globally is that in general, patients are only allowed to see physicians that are licensed in their state in the United States or in their country by country, which really limits the ability for physicians to provide care to individuals who are not located in the country where they reside. I don't know what the laws are in Lithuania. I don't know what the laws are with Lithuania. So we have seen people bring people long distances to be seen. I don't necessarily recommend that. I would try to see, are there experts in Parkinson's disease in Lithuania? I suspect that there are. Maybe we can try to find out. Maybe Dr. Bas Bloom, who is one of the officers of the International Parkinson's and Movement Disorder Society, can identify some Parkinson's specialists in Lithuania and that we can post on our website. Bas, I hope you're listening. Someone else wrote in, the EPA has recently reversed its ban on numerous toxicants. They also want to redefine science, in quotes. How should we fight these trends?
So Dr. Todd Scherer, the CEO of the Michael J. Fox Foundation, testified in front of Congress, ensuring that we use all scientific evidence available to guide policy decisions. The idea that we should exclude certain scientific evidence to make policy decisions is counter to all the basic principles of science, which are to increase knowledge. If we have knowledge, we should use that knowledge and apply it to battling coronavirus or to fighting Parkinson's disease. And until we end our silence around these environmental risk factors that are linked to Parkinson's disease, we'll continue to be exposed to them. If there were a 1 million-person march on the EPA, it would change the course of the disease. And by the way, Parkinson's disease is apolitical. One of the most conservative Republican senators resigned from Parkinson's disease in December of 2019, Senator Johnny Isakson, who's been an advocate for Parkinson's disease. Jose Verano, a congressman from New York City, will not seek re-election due to Parkinson's disease this year. So we have one of the most liberal congressmen and one of the most conservative senators, both with Parkinson's disease, both ending their political careers because of the disease. Parkinson's disease does not discriminate based on politics.
And then we have one last question for you here. What are some of the biggest challenges you face when developing remote digital assessment and treatment of PD?
So in order to get better treatments for Parkinson's disease, we need better measures of the disease. Many of you who've come to clinic know that we have you tap your thumb and index finger. And right now, the way we measure Parkinson's disease, you have someone like me rate down a score from 0 to 4, and I might say it's a 2, and my colleague, Dr. Holloway, might say it's a 1, and Dr. Bloom might be right and say it's a 3. But when you have subjectivity in assessment, it's really hard to tell whether a new intervention works. We need objective, sensitive measures of the disease that reflect how people are doing, not just in clinic, but in the clinic and in the 99.9% of their time that they're not in the clinic. We carry around supercomputers everywhere we go. These supercomputers and watches can provide us objective measurements of the disease. Dr. Boss Bloom and his colleagues are leading many of those studies in Europe, and we're trying to lead many of those studies here in the States. Well, thank you again very much for all your time and questions. If you guys think this is a great idea, we'd be happy to do this again. Let us know. Give us suggestions for what you'd like to hear about. Maybe we should start having virtual book clubs throughout the world. We should be socially connected through these challenging times with the coronavirus. And as soon as we are done addressing the coronavirus, we should turn our attention to ending Parkinson's disease. Again, we encourage you to purchase the book. You can order it on Amazon, Barnes & Noble. Discounted books for support groups are available on BookPal. All the author's proceeds are being devoted to efforts to help end Parkinson's disease. And together, we can address one of the great global health challenges of our time. Thank you very much.
Thank you, everyone, for joining. If you'd like to keep in touch, hear from us in the future, please again enter in your contact information on endingpd.org/raffle. That's endingpd.org/RAFFLE. Thank you, and everyone stay safe and have a good night.